Hi, I'm Dr. Ryan Bober from AskYourMD, and today I want to talk about diagnostic testing for SARS coronavirus 2, or COVID-19. I know there's so much information out there, but it's important to make sure that you fully understand what the testing means and how to interpret the results, because I'm still getting questions every single day in clinic about the most appropriate way to understand what your results mean for you. If you haven't yet seen my video on antibody testing, check out my channel below and subscribe if you like any of the content. That's where I answer a lot of the specific information related to antibody tests. Today, we're going to look at testing that tells you if you have any evidence of the virus in your body right now. So let's get started. There are two types of diagnostic tests, and I'm going to try to simplify them for you. An antigen test and a PCR test. An antigen test looks for fragments of the virus, and this is often what's used for the rapid testing. If you have a positive result, then you should assume you're positive, you should quarantine for at least 10 days, and you should ask anyone who else has been exposed to do the same, or to get tested. If you have a negative result, then you need to get the COVID-19 PCR test. Interpreting the results of a PCR test is fairly easy if it's positive. You should assume it's positive and quarantine for at least 10 days and ask anyone around you to also get tested or to quarantine for 10 days. If you have a negative result, there's a few things to keep in mind before you can just assume that you're truly negative. In general, it does mean that you probably do not have detectable virus in your body. But think about how long it's been since you were last exposed to somebody before you got the test. If you were exposed today, and you got a test every single day for the next week, having a negative result is more helpful if it's on days 5, 6, and 7 than if it was on the first 4 days, because it does take some time for the virus to become detectable in the body. So getting the test around days 5 to 7 is more reliable, based on the studies we have available, to say that you're truly negative. The next feature is, was the sample collected properly? Saliva tests in general do not perform as well as the nose swabs, so try to get a nose swab if possible. And the self-collected nose swabs, which are available sometimes from certain companies that are sent to your home, those perform relatively well in the middle of the nose as compared to swabs collected by clinicians. But if you have a negative result and you were exposed 5 to 7 days ago and you're not having symptoms, then you should be able to trust the result of the test. So I hope this was helpful in understanding what your negative result means or what a positive result means. And if you have any questions, you should talk to your provider to help you interpret the test a little bit better. One final caveat is that if you do have a positive test, you should not get retested for the COVID-19 virus for at least 90 days, because you might have detectable virus in your nose for up to 3 months, even if you don't have virus that is able to be spread to others in a way that causes illness. 10 days after the onset of symptoms, it's very, very rare that we've found anybody who can actually spread the virus to others in culture. So that's what the purpose of the 10-day quarantine is. This does not apply to people who are immunocompromised or have a weakened immune system who are asked to quarantine for 20 days. But in general, if you are exposed, you wait 5 to 7 days and you have a negative test, you should feel a little more comfortable on the day of that test that you were truly negative. Thanks again for coming by, and if you have any other questions, please let me know. I know this is confusing, but I hope this video helps clear up some questions for you. See you soon.